Have you ever come across a situation where you suddenly find somebody unconscious due to trauma or accident or possibly a cardiac arrest? In such a situation, CPR can be a life-saving technique.
When you find a person unconscious somewhere in the middle of the road or any place, you immediately shift the patient to a safer place where you can start the basic life support. It is not only for the safety of the person unconscious, also for the safety of the person delivering the life support. It can be done by anybody. Initially, you have to look for response in the patient. You have to stimulate the patient.
ஐயா நல்லா இருக்கீங்களா? உங்க பேர் என்ன?
If there is no response, without any further delay, call for help. Kindly loosen them first. And then look for the bone in the center of the chest. It starts running from the top to the bottom of the chest. And when you identify the base of the chest bone, after identifying the lower end of the chest bone, we have to extend both our forearms, and we have to keep the right base of the palm on the lower end of the sternum, and then we have to keep the left palm over the right palm, interlocking both the palms. Now we have to put on our full weight and start giving chest compressions on the lower end of the sternum, just like this. The compressions should be fast. We have to aim for around 100 per minute, and we have to continue this until help arrives. When you are tired, you can ask the other person for help. The elbow should not be bent and it should be straight.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 6.
These are all the 4 steps consist of the basic life support. Number 1, scene safety. Number 2, identification of the unresponsiveness. Number 3, call for the help and emergency medical system activation. Number 4 is the external cardiac compression. The 4 steps we have to keep on doing that. Now, is there any help has arrived, we can hand over the patient to them, or in between the patient response, he is showing some kind of consciousness response. Previously he is not responding, now he is responding something, coughing out and started breathing on his own. You can stop, just observe him till the medical team arrives. So you keep on doing the 4 steps, the external cardiac compression again and again. The patient is highly likely to be regain his consciousness without any cardiac arrest.
Omandurar Medical College and Hospital has started CPR training for general public.
So basic life support. Why we should know about basic life support, especially the public? Because the patients are not, most of the patients are having this kind of the cardiac arrest or unconscious when they outside the hospital. From the outside the hospital till they reaches the hospital, there is a precise time is lost. So when there is the basic life support measures are done by the persons who is nearby available to the patients, it will be useful to reduce the complications. In what way it is going to reduce the complications? If the patient is resuscitated, that the cardiac functioning started within 3 to 5 minutes of its own stoppage, there is a very much loss, there won't be any much brain damage. That's why it has to be done by who's available nearby to the patients, not only by the medical expert. If the public knows about this kind of the resuscitative basic life support, the precise time of 3 to 5 minutes will be preserved and there won't be much damage, brain damage to the patients. This basic life support should be learned by everybody, and it can be done by anybody, anywhere else.